AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency servicing Broward, Miami-Dade, and Palm Beach County, and you can reach us directly at 954-717-7027. I am your host, Louise Gomez. Welcome to the show, everybody. And today we are delighted to speak with Dr. Marc Silver, who is an orthopedic surgeon. You can reach him directly at 772-212-0732. And he is right here in Port St. Lucie, currently available in Martin South, Wright and Stewart. And I believe in May you'll be launching in Traditions Hospital. Welcome to the show, Dr. Silver.
Pleasure to be here.
Oh, nice to have you. We thank you so much for taking time out of your busy schedule to hop on the interview. We're always excited to introduce different doctors just to learn a little bit more about your specialty. So we see you are an orthopedic surgeon. So can you give us a little background? Where'd you go to school maybe, and when did you decide you wanted to become an orthopedic surgeon? How was that trajectory? Yeah.
So to give you a little background, yes, I've always had kind of a passion to be a physician. I grew up actually in a physician household. And nice. I think, seeing the, enjoyment that my father had kind of had an impact on me. And then
I love that.
It was a good childhood. And then, so after graduating college, where I majored in pre-med biology, then I went to medical school, did my orthopedic surgical training, and then I did an extra year subspecialization in sports medicine. So I was at Yale for that, and it was a great experience. I got to treat all the Yale athletes, was on the sideline for all the Yale football games.
Exciting.
And after I left Yale, I went into practice in Connecticut. And then as of last month, I became a Florida resident and now working for the Cleveland Clinic.
Congratulations. We're lucky to have you.
Thank you.
Absolutely. So tell us a little bit more. I kind of get confused when I hear sports medicine. I'm like thinking, is this something like physical therapy, or who would qualify to see, what type of patient would qualify to see a physician like you?
So just to give you some background, sports medicine deals with treating athletes and non-athletes alike with sports-related injuries. Injuries related to the knee, to the ankle, shoulder, anything that deals with a ligament, torn cartilage, and even fractures. And there are sports medicine doctors who trained a little bit differently. They're non-surgeons. And then there are orthopedic surgeons who train in sports medicine. And we're able to treat some of these sports injuries surgically, although we do a fair amount of non-operative treatment as well. And like I said, we see the whole spectrum of elementary school athletes to, I just saw an 80-year-old pickleball player who had an Achilles tendon injury today.
I heard that's common now. Everybody's with the pickleball, so that must be a common injury down here, right?
Pickleball, how can I say this? It's going to be like an annuity plan here in the office because we are seeing a lot more pickleball injuries. And yes. We're doing the best to heal these patients and get them back on the pickleball court in a safe manner.
And I like how you mentioned how, you try to, I guess, treat it first in a different type of way, like what types of, I guess, treatments would you offer as opposed to maybe, as, someone may be fearing right away, I don't want surgery or I don't want invasive, procedures. So what are the types of treatments that you can offer for the different injuries that people have?
Yeah, so even though we are orthopedic surgeons, I'd
Hmm.
probably say the majority of our patients that we're seeing are actually we're able to treat and get them better without surgery.
I like
And
that. Yeah.
different ways of doing that. We can treat them in the office with sometimes we'll give various injections into the joints or the tendons depending on the problem. A lot of times we'll rely on physical therapy. Physical therapy is very important and
Hmm.
plays a big role in sports medicine. So not everybody coming to see the sports medicine orthopedic surgeon is going to wind up on the operating room table.
Good to know. So tell us a little bit more about the practice. How is that set up as far as multidisciplinary specialists? Do you offer any type of, what are the other types of specialists that are there at the office?
So in our office, we have run the whole spectrum of specialization of the different orthopedic subspecialties. So, for instance, we have surgeons who deal just with the hand and upper extremity.
Okay.
We have sports medicine surgeons, and then we have surgeons who do joint replacement. We have podiatry, deals with foot, and then we also have, because the Cleveland Clinic is a multi-specialty
Sure.
large hospital, we have sometimes we'll refer patients to neurosurgery,
Mm.
pain management. We can refer to the appropriate subspecialty if it's not something that we take care of or if it's a non-orthopedic problem.
Oh, that makes sense. And what are the latest treatments that are out there for, I mean, pain management is huge. And, obviously, people are looking for different alternatives, not always necessarily medication. What are some of the other alternatives that one could expect to maybe experience looking to have pain management?
So I'll refer patients to pain management. So a lot of people have, let's say, either a back or a neck problem that's not getting better
Right.
uh, with physical therapy. So
Mm-hmm.
pain management, they'll evaluate the patient and sometimes give them steroid injections into
Okay.
various parts of their spine. I have patients also who are candidate or need a knee replacement, but for some reason they're either not candidates because of some medical reasons, or
I
they're
see.
uh, maybe they're working on a diet to lose some weight. So as a temporizing manner, sometimes I'll refer to pain management where they'll do a what's called a radio frequency ablation. They'll do a procedure where they can freeze kind of the nerves around the knee.
Oh,
And
okay.
sometimes that works to temporarily relieve arthritis type pain until the patient is ready and can undergo surgery.
I like how there's so many different options. I like to share with the audience, that there's just a variety of different options nowadays. And what type of what are the common surgeries that you're doing as far as seeing patients in your practice? What's a common
So,
injury?
so common injuries we see. So let's say knee injuries, and again, we'll see this in pickleball players, soccer players, basketball players. Typically, a twisting kind of knee injury. They can injure the meniscus, which is the cushion that sits between the two bones of the knee, acts as a shock absorber. We can treat that arthroscopically. Very common, and what everybody always hears on the news is a ligament injury. And the major ligament that athletes tear is the anterior cruciate ligament, or ACL.
Oh,
And
yes.
so, if patients are candidates for surgery, we'll do what's called ACL reconstruction. We'll take a ligament either from another part of their knee, or sometimes we'll actually take it from a tissue bank and use that to replace their deficient ACL. We're able to do these techniques arthroscopically, so it's kind of minimally invasive. as opposed to how they were doing these procedures, 40, 50 years ago.
Mm-hmm.
Athletes also they'll get injuries to the shoulder, and very common is to see rotator cuff tears.
Mm-hmm.
So if sometimes we'll treat them non-operatively with physical therapy, sometimes we'll give cortisone injections, but if patients are just not progressing as we expect them to, or they're a higher functioning athlete that needs to perform at a very high level,
Yes.
then we will offer them arthroscopic surgery, which again is a minimally invasive type procedure of the shoulder. Allows us to evaluate all the structures in the shoulder, pinpoint the structure, in this case, the rotator cuff tendon that's torn, and then we're able to repair it with various instruments, and then get that patient back to their level of function that they were hopefully beforehand.
Yeah, I remember my son in college was playing basketball and had that ACL surgery. What's the average turnaround time for somebody who undergoes a surgery like that?
So the surgery itself is done in an ambulatory setting, so that the
Uh-huh.
patient gets to go home that same day.
Yep.
But the recovery can take anywhere from 9 months to a year till they're back playing their sport. And as I always explain to the patient, every month you're getting better, stronger, and faster. But to really, I guess, put you back at the maximum level of function in a
Mm-hmm.
safe manner where, less likely to injure yourself, that's what takes the 9 to 12 months till you're back playing that sport that you desire to play.
Right, right. We have a quick commercial break, Dr. Silver. We'll be right back, and everybody stay tuned. We'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
We are back. We have Dr. Marc Silver. His phone number is 772-212-0732. And he is an orthopedic surgeon right here in Martin South in Stewart. Thank you for joining us again, Dr. Silver.
Thank you.
So, we're learning so much about what goes on in the practice and all the different treatments that you're able to assist with. I want people to know, when they think of your name, what is it that you're specializing in? Is it knee surgery? I know, or do you do it all, or can we?
So any kind of sports related injury,
Perfect.
and you can extrapolate that to shoulder injury, knee injury. Take care of sprained ankles, fractured ankles. So, and you don't necessarily have to be an athlete. You can be.
I like that.
weekend warrior. You can be a couch potato,
Right.
but we'll we'll treat you appropriately based on the injury and your level of activity.
I like that because even though, like you said, you don't have to necessarily be an athlete, because, like you said, weekend warrior, how many of us are out there, on the weekend doing the 5K or just trying to, stay in shape and maybe start taking pickleball or tennis or whatever it is. And then we happen to have an injury. So we want to make sure we're in good hands, we're seeing the right doctor, and that we have all the different options available, right?
Yes, and that's the majority of the patients we see are not Division One players. They're
Right,
everyday people who want to maintain an active lifestyle.
right.
That's why we come to Florida.
I know. So, what was your experience like in Yale? You were seeing obviously young athletes. Was that what was that experience like for you?
Yeah, it was a great experience. So you get to travel with the team. I mean, you're really responsible for the team. I'm talking specifically the football team.
Sure.
And you're on the sidelines during the game, and if there's an injury, you're responsible. You have to go out, evaluate the patient, and then
Right.
you're making the call if this patient is, or if this athlete can go back into the game or not.
Wow.
Uh, and then we had a special clinic where we would treat all the athletes from Yale. So I'd see from the swimming team, the hockey team, basketball team, football team, and you really kind of get us, you're up on the latest
Yeah.
learning from the athletes and from the institution itself.
Sounds
And I have to
exciting.
it was great. I have to give credit to my colleagues who I worked with up there and my boss who trained me. So I owe it all to them, partly on what I'm doing today.
I love that. It sounds like it was an amazing opportunity. Maybe a lot of pressure I make up, but an amazing opportunity to
Uh,
to get hands-on
Good
experience.
opportunity. And one thing I always remember, somebody once told me, pressure makes diamonds.
I love that. It is so true, right?
So I always remember that from medical school.
That is so true. That is absolutely true. So, I'm so happy you're here in South Florida treating, there's so many of us that need the top-notch services that you offer. And we appreciate that you don't have to, like you said, you don't have to be a D1 athlete to see you. There's just a broad range of patients that you're seeing. You just said you see young adults or children to adults. Is that correct?
Yeah, see the whole spectrum of life.
Uh-huh.
Um, and and again, I have also support from my colleagues and my partners here too. So if it's something that, let's say, I can't take care of, chances are one of my partners can take care of that particular problem.
That's good to know. Where do you see the future? I always love to ask doctors this. Where do you see the future of medicine with the technology that we have available maybe in the next 20, 30 years? What do you see?
Yeah, it's a very good question. It's, that's one thing. Medicine is a field that's constantly evolving.
Yes.
So procedures I was doing, 15 years ago, we're doing it now differently, or we're doing a different procedure. So it's one of the fields that if you don't kind of keep up
Yeah,
with the changes going on, uh, if you're not on the inside, you'll be on the outside.
that's right.
So the trend now is, we try to do things, I guess, minimally invasive, less trauma to the patient or to their extremity.
Hmm.
We're very conscious now of pain control. We're trying to get away from just giving patients narcotics post-surgery.
Right.
We have our anesthesia colleagues now do what's called regional nerve blocks during the procedure, before the procedure, to help control some of the post-operative pain. So these are the things that we're more conscious of today. We're using a lot of robotics now, especially if we're our joint replacement colleagues.
Oh,
But
I
I'll,
like that.
Yeah, so I think one of my colleagues is going to speak more about that. I don't want to steal his thunder.
Oh, okay, good. So we love how you stay relevant and you're always looking to, maintain your, the level of modernization by staying relevant and being able to do that. And we know that where you're at is a great area as far as in Port St. Lucie. They're going to be opening in May at the Traditions Clinic. Is that right?
Yeah, Tradition
Traditions Hospital.
Hospital, Ortho Express Care. So a lot of stuff happening here at the Cleveland Clinic. We're moving forward. We're trying to serve the community and
Nice.
keep everybody happy, active, and healthy.
And that's very important because I know that the population in Port St. Lucie is growing rapidly. So we definitely need that type of care. We need that type of medicine over there because of the population boom that we're having
I
over
mean, I
there.
see patients every day. Everybody's coming in from the northeast,
I know. It's amazing.
like myself. So it keeps growing. Yes, it's
Yeah,
tremendous growth here.
absolutely. Dr. Silver, we have 2 minutes left. What would you like to share with the audience as far as your vision and your goal for the location and for your
Uh,
future of your patients?
Future my patients. So I think again the reason I came down here. So when I was looking around to come down here, I interviewed with the Cleveland Clinic, the group that's down here in Martin South. It's a great group, very well trained, very well specialized, and it seemed like a very nice, comfortable, family-oriented
Nice.
group that I think really gives good care, cares about the patient, and it was something that I felt would be a good fit for me and the way I kind of want to practice medicine today.
Well, we're so lucky to have you. I'm going to give your number out again. Anybody listening, please reach out to Dr. Marc Silver, 772-212-0732. And thank you so much for being on the show. We're so lucky to have you in the area, and thank you. Have a wonderful evening.
Thank you for having me, Louise. You too.
Absolutely. Take care. Bye-bye.
Bye.